This is Jun Cai from Hypertension Center for Hospital in Beijing. I am really happy to be here to report our STEP trial. The optimum blood pressure target is an important issue to be concerned. Recommendations from recent guidelines are yet contrasting. The ACC and the AHA hypertension guideline set a threshold of less than 130 millimeters, whereas the European guideline recommended 130 to lower than 140 for older patients. To clarify this issue, we launched the STEP trial, a prospective multi-center randomized controlled open-label study. Only 9,624 hypertensive patients aged 70 to 80 years screened. 8,511 were randomized assigned to the intensive treatment group with SBP targets 110 to 130 millimeters, and to the standard treatment group with SBP target was 130 to 150. During the 3.34 years follow-up, the blood pressure was separately well. The mean systolic blood pressure was 126.7 and 135.9 respectively, with a between group difference at 9.2 millimeters. The primary outcome is a composite of adverse cardiovascular events, including stroke, acute coronary syndrome, acute decompensated heart failure, coronary revascularization, atrial fibrillation, and cardiovascular mortality. Intensive treatment reduced the risk of primary outcome by 26%. The p-value was 0.007. Results for the most of secondary outcome also favored the intensive treatment. Our results showed the intensive blood pressure brought 33% reduction in stroke, 33% reduction in the acute coronary syndrome, 28% reduction in MACE and cardiovascular mortality, 73% reduction in heart failure. These results were indeed exciting. However, the coronary revascularization and atrial fibrillation and also all-cause mortality were not significantly different between two groups. The beneficial effects of the intensive treatment were consistent across our pre-specified subgroup analysis, including age older than 70 or not, sex, baseline SBP level, prior diabetes, and 10-year Framingham risk score. As for safety outcomes, intensive treatment increased the incidence of hypotension, but no difference in dizziness, syncope, fracture, and importantly, renal outcomes. So in summary, our STEP results support that for older patients, the SBP target should be set lower than 130 millimeters for bad cardiovascular benefits. I sincerely thank all the investigator, trial teams, and participants for their contribution. So thanks.